talking to you guys about the Australian Tele-trial Program. And before we start, I'd just like to acknowledge the traditional custodians of the land on which we meet today and recognise their connection to land, wind, water and community. I'm presenting to you today from the Gulumbil Borough Wulkurukaba country, and I pay my respects to elders past, present and emerging, and I extend that respect to Aboriginal and Torres Strait Islander peoples that are here today. So thank you for the opportunity to present about this program. First of all, I wanted to set the scene in terms of our fellow Australians that live in rural and remote areas. On average, they have shorter lives, higher levels of disease and injury, and poorer access to and the use of health services compared to people that live in metropolitan areas. Australians in rural, regional and remote areas face barriers when they're wanting to take part in clinical trials, which includes distance, cultural differences, geographical isolation and workforce capacity. The Tele-trial model seeks to improve health equity for regional Australians by increasing accessibility to clinical trials and also supporting our rural and remote health centres to deliver clinical trials locally. Clinical trials are traditionally conducted at tertiary or metropolitan health facilities where patients will visit the hospital to participate in trial activities. So when your home is located in a rural and remote place in Australia, like Winton, Western Queensland or Alice Springs in the Northern Territory, you often have to travel hundreds or thousands of kilometres to be able to join a clinical trial. And that means being away from your family and your community for often really long periods of time, and usually multiple times to be able to meet the study requirements to be able to access that treatment. So teletrials is a new way for people to be able to participate in clinical trials, bringing the trial closer to home by using telecommunications to connect the tertiary or metropolitan hospital with a nearby health facility. So this is what the model looks like. They are essentially a subcomponent or a type of decentralised clinical trials, which are models that allow for some trial activity to occur at locations other than those traditional trial sites. So these trial activities can be done in a participant home or at local healthcare facilities. A teletrial is specifically a group of clinical trial sites working together to conduct a clinical trial under the supervision of a primary site and its principal investigator. So decentralised clinical trials allow patients to receive treatment direct to home, but the teletrial model, what it does is it actually brings it to their local health facility or to their local GP. So sometimes it can't be, the GP that's just down the street. Sometimes it has to be like the rural hospital that's still 100 kilometres away, but it's so much closer than having to travel thousands of kilometres to the primary site, which might be the tertiary hospital located in Brisbane or Sydney. So through the telecommunication technology that we now have since post-COVID times, the primary site and the satellite site communicate with each other to enable delivery of some of the aspects of the clinical trial at that local health centre or health facility that's the closest that we can get it to the patient. The principal investigator continues to be located at the tertiary centre, which is the primary site, and then they supervise doctors or nurses that are located in a satellite site to conduct those activities that have been delegated down. Now, the satellite sites might not have all of the infrastructure, equipment or resources on hand to deliver the trial completely on their own, which means some of them might not be able to be a primary site in their own right. So what it does is it enables us to support them to the level that they're capable of delivering some trial aspects. The principal investigator at the primary site remains completely responsible for the conduct of the trial at all of the sites within a cluster, including including the activity at the satellite site and the activity at the primary sites. And we define a cluster as a group of 2 or more sites undertaking the same study. So one primary site and at least one satellite site. Now, a cluster can be made up of health facilities or health organisations, all within the one organisation, or it can be across different types of health services. So you might have a primary site being the Toowoomba Hospital, and then the satellite site being a GP practice in Roma, and a health facility at Longreach Hospital. The model is enabled through 3 key documents, which is a supervision plan, the delegation log, and a subcontract or sub-agreement. Now, the participants may have some trial visits or some trial activities at the primary site and at the satellite site, but this is determined when we do the site feasibility or site acceptability process. We work out what is the capability or infrastructure and equipment that's available at the satellite site that's as close as we can get to a participant's home. And then we work out what trial activities can be delegated down to that particular satellite site. So we might find that the health facilities or GP practices that are closest to the participant, we can't deliver the main trial intervention at those sites. So they might still require the participant to travel to the primary site to receive the main intervention, but then at perhaps like the 12-week mark, we can return the participant home, and then they can receive all of their follow-up visits and follow-up care through their local GP practice under the supervision of the principal investigator at the primary site. And that's the key part about the supervision plan, is that it details what those activities are that are being done at the primary site and what's being done at the satellite site, and makes it really clear who's responsible for what throughout those specific schedule of activities for a specific trial. The delegation log then details all those responsibilities by the staff members' names and roles, the standard way that we do delegation logs. So it becomes like a really key supporting local document to the supervision plan, which details the conduct of the study across the whole cluster. And then the Tele-trial subcontract formalises that relationship between the primary site and the satellite site. So you can understand that, especially when we've got clusters operating across multiple organisations, how important it is to have that formal document that clearly describes who's going to be doing what for the clinical trial. And it even takes down like pass-through information like contractual obligations from the head agreement or from the sponsor of the clinical trial through to the satellite site, and also any pass-through costs, so any payments or fees that can be covered by the sponsor, that's also covered in the Tele-trial subcontract to make sure that everything's paid for correctly at the things being done at the primary site and also the things being done at the satellite site. Now, these enabling documents are overseen by the study sponsor and the local site governance process for both the primary site and the satellite site. And ethics committees in general will not see these documents as part of the ethics application, but rather it would be completed or submitted as part of the site governance process. Some of the benefits of using the Tele-trial model is that we increase equity of access for Australians living in regional, rural and remote locations. They can receive their care closer to home by having the trials provided by the GP, the regional health facility or a rural hospital, which reduces the requirement to travel, and it also increases their participation in research and in the long term improves their health outcomes. It also increases the potential for trials to reach more diverse population groups and help meet the recruitment targets of a specific trial, as well as making it easier for people to stay in the trial, reducing the dropout rate. The model provides opportunity for sites to engage in clinical trials congruent with their own capability and service deliveries. As we said, we map the satellite sites' infrastructure, equipment, and workforce capability, and then we make sure that anything that's delegated to them in the supervision plan is appropriate for what they're capable of delivering to the patient, and that they're supervised appropriately by the primary site. In doing this, what it means is that we're developing clinical trial workforce right across the country. So not just in our built-up areas or in our metropolitan centres. We're able to engage with our rural and remote health providers so that they can do research and they can participate in clinical trials, even if it means that they're just engaging for the follow-up phases. It also helps sponsors and investigators expand their research across more broad clinical areas. And it means that for sponsors of clinical trials, they are only engaging with the primary site and they're not having to oversee or engage with the satellite sites, because the satellite sites are supported and supervised by the primary site. So what does this mean for ethics committees? The ethics application should describe that a teletrial model will be used for some or all of the sites involved, and the applicant should identify to you which sites are going to be the primary site and the satellite sites. Now, you usually won't receive additional or different documents from what you would normally get in an ethics application, except for you may receive a teletrial specific consent form if they're using one. Now, I do note that the teletrial model is relatively new to the industry. So whilst we've been conducting teletrials since about 2016, we're not seeing it integrated into study protocols, especially for our international clinical trials. And so what you might find when you get an ethics application using the model is that the applicant will describe it either in the cover letter or in the actual ethics application form itself. And you may also, as a HREC, receive requests to approve the model from the outset for particular sites. But more likely is that after the study's already been approved, what we're finding is that some of our sites and our principal investigators are going, oh, actually, I've got participants living in, a remote location or a rural location, and they're travelling for the trial. And then what they wanting to do is convert some of the sites over to a teletrial model. So you might, as a HREC, approve the study for 10 sites across Australia, and then 2 of those sites may convert to a teletrial model and add additional sites under their supervision. So you might see this come through to your ethics committee as an amendment rather than a model to be used from the outset. So things to look for when you're doing your review is that teletrials is not its own unique methodology. It is an approach for conducting a clinical trial. So it doesn't really vary in terms of how you assess its merit and integrity, and you should assess it under section 1.1 as you would for any clinical trial. In particular, though, I'd just like to draw your attention to E, which is about the people and making sure that they're qualified and appropriate. The team is made up of the right level of experience. Because we are doing the model as a cluster approach, you will find that the focus on the skills and experience of the study team will be on the primary site investigators and not so much on the satellite site investigators. Because one of the main goals of our program is to increase capacity and capability in our satellite sites in rural and remote Australia, where people might not have as much experience in conducting clinical trials. But it's important for HRECs to be reassured that the supervision plan and the way that we supervise the satellite sites is done in a very thorough way. And we would never delegate activities to a satellite site if they didn't have the capacity or didn't have the right supervision in place to do that. For the consent, this is another key element for reviewing the Tele-trial, Tele-trials as an approach in an application. The consent process is likely to vary between satellite sites, and in some cases, the principal investigator will take the consent remotely, so using telecommunications, or they may delegate it to an associate investigator or a trial staff member at the satellite site if they feel that they have the right skills and qualifications to undertake the consent process. Any of these variations between the satellite site delegations or responsibilities has to be approved by the sponsor first, and is also very well documented in a supervision plan. And what we expect to see in the coming years is that as the model is used more widely, study protocols will start to accommodate these different types of approaches and variations, and will be better described in the consent process in actual study protocols themselves. In terms of the participant information sheets and consent forms, there are a couple of different ways in which people can approach how they build in describing the Tele-trial model and informing participants about having that option in their trial participation. So you might see it included as specific wording in the master participant information sheet consent form, or you might find that it is the sponsor or the study team have decided to use a standalone Tele-trial consent form. So you'd have your standard study consent form, which describes all of the risks and benefits of the clinical trial, which the participant agrees to. And then if they get converted, they found that they're eligible to receive care closer to home, then they would consent to the Tele-trial consent form, which describes how their care will be managed at a satellite site and a primary site. And these two sections of the national statement specifically apply here about presenting information in a way that's meaningful to those participants. And that's why we've developed a specific Tele-trial consent form for use if study teams would like to use it. It's completely optional which pathway they use. It really comes down to what's appropriate for that study and what the preferences of the study team or study sponsor are. So if you're looking for more information about the Tele-trial program, or you have researchers in your network that would like to know a bit more about how to conduct a Tele-trial or how to use this approach in their clinical trial, I've included these links here. There's resources on all 4 locations. The best go-to place is just to Google Australian Tele-trial Program, and we link out to all relevant areas from our website. I also, just to finish up very quickly, wanted to let you know about the regional clinical trial coordinating centres. Now, these are located in 6 states and territories around Australia, and they are available to provide state-based support and expert advice, both to sponsors, to sites, to ethics committees, to research governance officers, and to investigators as well. They offer operational support, there's funding available, they do coordination and assistance in terms of establishing and starting up Tele-trials, as well as delivering education and training. So here in the program, we are available to support anybody who wants to conduct a Tele-trial, or anyone who's involved in reviewing and approving a Tele-trial. So whether you are a HREC, an RGO, or an investigator, we're here to help, and we'd love to hear from you. So feel free to give me a call, reach out and email us if you'd like some more information or you'd like to discuss Tele-trials in any way. So yeah, does anybody have any questions? Do we have time for questions, Hudson?
Well, we're wrapping up, but we have a half-hour break, so we can afford to go another minute or two. The one question that's come up is, what is the program hoping to do with the new CT framework for hospital accreditation? I'm not sure how to interpret that question.
Okay. Well, The RCCCs and the program, so the staff that we've employed across Australia, we are available to sites to assist with hospital accreditation for the National Clinical Trial Governance Framework. So if any sites are, undergoing that process and they're not sure, they need assistance or they'd like to grow their capacity so they can deliver more clinical trials, then they're very welcome to reach out to their local regional coordinating centre or to reach out to us in the program, and we can share resources and provide assistance in that space. Whilst it's not directly in our purview to help you get through your hospital accreditation, we're also very conscious that that is a very key part to delivering clinical trials now, and we want as many hospitals and health services to have the capacity.